Good afternoon. My name is Sherika Warfield, and today we are discussing legalization of marijuana. Medical use of marijuana has been legalized in 29 states and 3 U.S. territories. Its use is still a controversial topic as government officials still hold opposing views. Currently, research conducted by the Pew Research Center in 2017 noted that 61% of Americans are in favor of legalization in comparison to 31% from 2000. So why are we still debating the issue? Some politicians believe that marijuana use is a gateway drug. While this has not been proven through research, it actually brings us to a point of comparison. Research, in fact, has proven that states where marijuana has been legalized have lower opiate-related deaths. Side effects of marijuana include increase in appetite, short-term memory loss when under the influence, and increased lethargy when exposed to stronger doses. All of these side effects are reversible and don't pose any harm to adults. Now, let me point out that marijuana use has been proven safer than alcohol and opiates due to their low risk of addiction and cognitive impairment. This also does not extend to use of adolescents, as it is unsure how marijuana will affect their brain since they are still developing. However, let's discuss the benefits. Marijuana has been proven to decrease pain perception, stimulate appetite in those with cancer and other health disorders that cause them to not want to eat. It suppresses seizure activity and involuntary muscle movements. Because of its low affinity for addiction, health officials are getting behind the use of it to combat the opioid epidemic. As of 2016, 91 deaths per day has been attributed to opioid overdose by either prescription medication or heroin. This epidemic has magnitude to panic level, with EMTs and first responders needing and now having access to naloxone to reverse the effects of opiates. Medical marijuana, as well as legalization of recreational use, presents us with alternatives. As a nurse, the dangers of opiate use has become apparent. Too often are we tasked to monitor patients with substance abuse disorders that may have been started with a prolonged prescription for pain management. Medical marijuana alleviates this burden, at least at the hands of the prescriber. As of January 10th, South Carolina has proposed a bill titled the South Carolina Compassionate Care Act, which, if passed, will allow the medical use of marijuana for debilitating disorders that cause cachexia, severe pain, severe nausea, seizures, neurological disorders, and severe muscle spasms. This is a step in the right direction. Doctors for Cannabis Regulation, a national organization of over 50 physicians, are testifying and advocating for the legalization of marijuana, and that speaks volume. They cite their approval of legalization as a means for increased consumer awareness of the drug and strength they are using with the increased safety guidelines that come with being legalized. The Drug Policy Alliance cites the benefits of legalization, including reducing harm and violence to users, creating jobs and economic opportunities, saving money for law enforcement resources that can be best suited in other areas, and also promoting consumer safety for the same reason that the Doctors for Cannabis Regulation referenced. Public opinion has demonstrated approval for legalization. It's time to fully support the policy as a means to protect the public, decrease deaths associated due to opioid overdose, and allow for alternative therapies that have little to no severe side effects. I hope you all have enjoyed our discussion and can stand in solidarity as we move towards legalization of medical marijuana in all states. Thank you for your time and have a great day.